became a rad tech, I sort of knew that there were a lot of offshoots like ultrasound. But then once you're a rad tech, you have the opportunity to do whatever you like. Is it CT? Is it MRI? You know, do you want to go do ultrasound? Do you want to do interventional radiology? So many options as a rad tech. The neat thing is, as a rad tech, you also get to integrate with the rest of the hospital. So you're servicing your floors, your operating room, your ED. You build so many lasting relationships, but you also are a core part of what makes a hospital run. So the neat thing is, if you want to stay clinical, you can stay clinical. You can learn other modalities. And then if you ever want to be a leader, you can absolutely jump into leadership. So I do think the Rad Tech program is solid as a rock, for sure. And I'm so happy that that's where I started my journey. I always had a job, and I never forgot that, because we still were very active in healthcare. And a lot of the people around me were in very uncertain times, and I was not. So it just kind of brought me back to sitting in that psychology class and, you know, those jobs built to last. So again, just another amazing fact of why young people may want to go into the healthcare sciences. And I said, well, you know, I never regret my decision to go to Pima. I think it was the best thing for me, and I think a lot of people are like me that don't go into college saying, like, this is what I'm going to be. And you know, that led me into this career. And the interesting thing about this career is I still am not a person who said, you know, when I entered the hospital, I'm going to be the CEO. That was never my journey. I just said, I want to make the world a better place for people.